Hi everyone from beautiful and sunny Miami, Florida. I'm here to talk to you about my upcoming session, 30 Tips in 30 Minutes. This is the probably most highly sought after session and always gets the greatest ratings. We have world experts like Dr. Deanna Glazer and Mark Lebwall giving you the best, the top tricks and all the advice that they could give you in 30 minutes. I hope you guys can attend.
Hi everyone, I'm Terry Cronin. I spoke at the 30 Tips in 30 Minutes session today, and I gave a few little pearls that I thought were important. A lot of our patients these days are on blood thinners. It's just amazing all the different medicines that thin the blood. So how do we as dermatologic surgeons prevent the bleeding? Well, a couple of easy things that are available. One is called quick clot gauze. I don't have any relationship with them, but I learned this pearl from Susan Winkle. And you can get a roll of quick clot gauze and you can individualize that and you can put that in your autoclave, get it ready for each operation you do, particularly on the scalp or the face where it really bleeds a lot. If you take a Mohs layer and then put this gauze on it, when you come back, the bleeding is stopped. You don't have to do as much cautery or tying off of vessels because this product is so good. Another product that was really helpful in dealing with bleeding patients is something called wound seal powder. And wound seal powder I use on patients when I'm doing a biopsy, and many times patients are on Xarelto or Eliquis or aspirin or Coumadin or all the different anticoagulants. And so you can put this powder on them and it'll stop the bleeding, and that way they're not bleeding on their way home after the epinephrine wears off. Another tip I recommended was getting an autoclavable ruler. So much of what we do depends on measurement, and one of the codes requires that we measure a wound. Well, how are you going to do that? Well, a nice, inexpensive autoclavable ruler in your surgical set makes it very easy to see how much undermining you've done and to measure it appropriately. And with that, that's it. So I hope you guys enjoyed it.
Hi, I'm Gary Goldenberg, dermatologist from New York City. In my 30 Tips in 30 Minutes talk, I covered 4 tips. 1, you have to be the painless dermatologist. There are so many devices available now to decrease the pain of procedures in your office. It's a real shame not to use them. The 2 that I use the most are called Pronox and Target Cool. So I covered both of those. 2, I talked about the fact that it's okay if you take a shave biopsy of something that comes back to be a melanoma. Multiple studies have shown that if you take a scoop shave that goes to about mid-dermis, it doesn't make any difference for survival whether the tumor goes to the base of the biopsy. I also covered one of my favorite topics, which is discussing diet with your patients. And there's actually evidence that having a healthy diet, and multiple healthy diets are available for different patients, can decrease inflammatory diseases and also help with photoaging. And I also covered using devices to treat your patients with acne. There's some new devices that are approved that you can use in your office. For example, one called AviClear. And there's some devices that may be approved for other reasons that you can also use in your office, such as a 1064 wavelength laser.
Hi, I'm Dr. Susan Taylor with 3 quick tips regarding your hair loss patients. Number 1, body language is very important. You need to get in close, touch the patient's hair. The biggest cause of dissatisfaction is doctors not touching their hair. Also, to glove or not to glove, it doesn't matter. Just don't hold your hands in a surgical position. Next, when looking at patients with tightly coiled hair, it's very important that they remove their weave or their hair extensions to get a full exam. That might mean asking the patient to come back for another visit and refunding their copay. Finally, the most common misdiagnosis for frontal fibrosing alopecia in African American patients is traction alopecia. Be sure to look for the signs. In frontal fibrosing alopecia, we have the lonely hair sign. In traction alopecia, the fringe sign. Hopefully these 3 tips will help you to better diagnose your hair loss patients.